Hello, I'm Dr. Manning. This is my partner, Dr. Adams. We'd like to welcome you to Mississippi Vein Institute. This is a clinic that I started back in 2008 with the goal of creating a center of excellence for the treatment of varicose veins, spider veins, and venous ulcerations. When I first started, it was just me, my wife, and a 1,500 square foot clinic. We've grown into what you see today by consistently providing exceptional results for our patients. I thought we'd start by just talking a few minutes about why your legs look the way they do. Now, some of you out there are just going to have spider veins. Some of you are going to have varicose veins and spider veins. And some of you are going to have venous ulcerations. And those are all different stages of venous disease. Spider veins are the least severe, and venous ulcerations are the most severe. So let's start by talking about varicose vein disease, because it's kind of the most common thing that people come to Mississippi Vein for. Varicose veins are very large, ropey veins that you see at the skin surface. It's something that you typically inherit. You either get it from your mother, your father, grandfather, or somebody. And it's nothing that you can really do to keep from getting it. You know, at some point, it was going to manifest itself. It's sort of baked in the cake at birth, if you will. And over time, you just start getting these things at the skin surface. The thing to realize is that everything at the skin surface, none of that is your problem. Your problem exists in veins that you can't see.
You have larger veins deeper in your legs that we diagnose any problems with the ultrasound exam. These veins are filled with one-way valves. Now, these one-way valves are what makes a vein work. They're actually what makes a vein fail if and when they do fail. All these little one-way valves are basically made up of two little leaflets that basically overlap each other. And they're one way, they only open in one way, and that's back towards your heart. And I try to tell people that what moves blood up against gravity in the first place are muscle contractions in your leg. So for instance, I'm sitting in a chair right now, I'm not contracting any leg muscles. If I were to get up and stand in one place, I'm not contracting any leg muscles. So I don't have a lot of muscle squeezing a lot of veins. Now that squeezing of the veins is kind of like when you squeeze a tube of toothpaste. What happens if you squeeze a tube of toothpaste? Something comes out of the top. So that's the good thing about exercise and movement with veins. As long as you're up moving and you're active, you're squeezing veins, you're getting blood out of your veins. That's what the veins want. But God knew when He made us that we weren't going to be moving 24/7. So every time you sit in one place, every time that you stand in one place, you're not contracting any leg muscles. So the only force acting on the blood in these veins is gravity, and again, it wants to pull it down. That's why some occupations are worse for veins than others. If you're a hairdresser, what are you doing? You're standing up all day cutting hair. You're not moving a whole lot. So it's just gravity tugging at this blood, trying to pull it against these one-way valves. Well, what happens is, over time, these little leaflets that comprise this one-way valve get stretched. And they're designed to stretch to some extent and still open and close and make a little dam where blood can't flow backwards. And it can stretch to its max and still form that vein dam where blood can't flow backwards. But if you overstretch that vein too much, again, trauma, genetics, hormonal fluctuations can be the cause of this. Blood now can seep back between these two little valve leaflets. What happens is, over time, this valve fails so bad that the pressure falls and hits the next little valve. Over time, what you end up with is a big dilated vein that has failed. And every time you're not contracting leg muscles, for instance, sitting or standing, blood's going backwards. Well, where does all that backwards flowing blood go in those larger truncal veins? They go out into the little tributary veins on the surface, and that's what makes them bulge out. And that's why you have to address the deeper vein issues that a lot of our patients have. The number of veins you can live without is kind of hard to put your finger on, but the three most common ones we treat, and we treat all three of them in one leg quite often, there's no problem. You definitely don't need them. The reason I say this again, if a vein is not doing its job, and that's carrying blood up back to your heart, then the vein's not doing you any good. It's actually hurting your overall circulation, because your heart does not wait for your veins to catch up. Every beat of your heart, you're sending blood to your leg. If the veins aren't keeping up, then the blood's going to stack up in your leg, and that's where all our problems start with veins. So we would not treat a vein that you could not live without.
When you come in that day to get your endovenous procedure, when we go run the laser and treat your varicose veins, As soon as you get here, you're going to get checked in, and we're going to give you a sedative to take by mouth at that time. And then once you get back to the room, we put a little 22 gauge IV in, which is very small. It's not even hooked to a drip. We're able to give all the medicines just through a little stopper in the IV itself. You will have been marked. We'll have you stand for a little while, and one of our nurses will come in there. As you know, your varicose veins typically get a lot bigger the more you stand, so we want them to look as bad as they can at that time, so we'll know where they are. She'll mark them all with a small marker so that when you lay down, I know where to make those incisions to get the varicose veins out. But you're going to be laying on a very nice table. The table is, it's heated. It's like a Tempur-Pedic mattress. You'll be covered throughout. We're very respectful of your modesty and that kind of thing. You'll have nurses in there with you the entire time. Once we're finished, you will have nurses that will come in and they will wrap your leg with an ACE wrap. You'll get a wheelchair ride out to your car, and you'll be given our phone numbers, and if you have any problem at all, you'll be able to contact us directly. We do not have an answering service, so when you call us, you'll be either talking to me or Dr. Adams or one of my nurses, but we'll always be available to you 24/7. Our goal when we take varicose veins out is we're taking them out through micro incisions that are so small we don't sew them. We just put a little steri strip on them. But we want absolutely no mark. And so depending on your skin type, depending on your age, that sort of thing, we have some really good scar cream that we may recommend that you get. It's not expensive, and what I know about any type of incision, any type of scar, any type of mark on their skin, the quicker you can start treating it, the better. If you start trying to put a scar cream on a scar that's 10 years old, it's not going to do anything. But if you put on it early, while it's healing, during the healing process, it can make a huge difference. So we may recommend that. That's not something you have to get, but depending on your skin type and your age, our goal is to leave no mark on you. And we're going to do everything in our power to make that so. Okay, some of you are going to have just spider veins, but we're still going to ultrasound you. We take you back and look at your underlying leg veins because some of you will have spider veins that are caused by an underlying venous problem. And if you don't treat that, all the sclerotherapy at the skin surface won't work. And we see people all the time, women that have spent thousands of dollars on sclerotherapy at other clinics, and it's never worked for them. They come in and go, Mike, it just doesn't work. Well, the reason it doesn't work is because they got a problem in a different spot. We'll identify that with the ultrasound, fix it in conjunction with doing the sclerotherapy, and we get a fantastic result. The thing you got to know about sclerotherapy is, in general, it's going to take more than one time. It just is, and you got to know that. Everybody wants it to take just once, but the reality is we can usually kill about 70% of your spider veins with one time. Some of you are going to have venous ulcers. Venous ulcers are the absolute worst form of venous disease that you can have. And the venous pressures in your leg have gotten so bad over time that you begin to thicken your skin, and it gets so thick that over time you can't feed it anymore. The little capillaries that grow in and feed your skin will break down, and you'll get a non-healing sore that will occur above your ankle. It'll either be on the medial side or the lateral side, right above your ankle. The thing to know is that venous ulcer is caused by an underlying vein that's gone bad. So if you treat it at the surface, like a lot of wound care centers do, they can get it to heal for a little while, but they hadn't taken care of the problem. The problem is beneath. And we're able to access those sick veins beneath and fix it from the inside out. And when we do that, most venous ulcers heal within 6 weeks, 8 weeks tops from what we do. Now we'll continue seeing you during the healing process at a routine interval. We'll keep you in compression hose until that venous ulcer has fully healed, but the take-home message is that our goal with respect to venous ulcers is to fix them. Not just fix them for a little while, but fix them for life. That's our goal, and more times than not, that's what we're able to do. We send patients back to work on the 3rd day as a general rule. The first day, you'll go home and keep your leg elevated, and that's kind of a 20% day. You just need to take it easy on the couch. The second day, you'll still have the ACE wrap on your leg, but now you can get around the house and kind of do things at home. On the 3rd day, you're going to take that ACE wrap off and you're going to put your compression hose on and you're going to go to the gym. You're going to go back to work, you're going to resume your normal activities. The beautiful thing about this type procedure relative to how it used to be done is that people can return to their activities very quickly. Patients ask me a lot of times, is it painful? And the reality is it's really not. We sedate you comfortably for the procedure. We give you some Versed and fentanyl, so you really don't know that day very much. You don't have very much recollection of that day at all. Now you're awake enough that we can talk to you if we need to. You're just not going to remember it. After the procedure's over, the amount of pain that you have is very little because we put a lot of local anesthetic in your leg in order to run the laser. So the numbing fluid lasts for about a day in your leg. For the most part, people are able to take Motrin or Aleve or Advil, and that takes care of the pain quite well. Everybody wants to know about insurance coverage. You know, most of the things that we do at Mississippi Vein are covered by insurance. The only exception to that is sclerotherapy for spider veins. Insurance companies view that as a cosmetic concern. And so we try to keep our charges very reasonable because we know that you're paying for that out of your pocket. But we got to charge something for it because it takes a lot of skill to do it, and the medicines that we use are the absolute best that you can buy. So that's a cash price. That's something you'll pay on the day that you get it. The only other thing that you will buy with respect to sclerotherapy is your compression hose, because you will need to wear those for a few days after sclerotherapy. And just keep in mind, like we talked about before, you're going to need more than one time. So that's the take-home message. How many you will need, only time will tell. We'll do your sclerotherapy, wait a month, see what we got, and go from there. That's typically the way it works. But with the bigger cases that we do with respect to venous ulcerations and varicose veins, insurance does cover that. We'll be able to tell you before you leave today what your out-of-pocket cost will be and what will be covered by insurance. But most stuff, thankfully, is covered by insurance here at Mississippi Vein. Coming back for follow-up is critical because it allows us to assess our work. You know, if you hadn't got the kind of result that we want, we got to know it. We got to see it, and we will. We're the worst critics by far. I can assure you, if I like it, you're going to love it. I mean, that's the bottom line, but coming back for your follow-ups is critical. Do not miss those. You know, come for that 2-week and come for that 3-month, because at your 3-month follow-up, we're going to take your after pictures, and guess what? We give them to you. All right? So the pictures aren't going to lie. Somebody that wasn't committed to doing excellent work would not give you those pictures. I'm going to give them to you because I know they're going to be excellent, and if they're not, we're going to make them that way. The biggest part of the magic of Mississippi Vein, you know, I talk a lot of times about the magic. The magic of this place is the staff, is the people that I have been able to assemble here. My partner, Cliff, my wife, Scarlett, and, you know, all the other people that work here are excellent, and they have been hand-picked. You know, I've been a doctor in this town for a long time, and I knew who the best people were, and I went and I got them. And they work here every day. They're my friends. We socialize together, and you'll sense that. You know, you'll hear a lot of laughter in this building. That's what makes it special. That's what makes it different, is the fact that we are so committed to getting you an excellent result. We take such great pride in what we do because we understand that your result is our reputation. I understand that. We all do. And so that's why getting an excellent result here is not an option. That's just the deal.